The U.S. can slash healthcare costs 75% with two fundamental changes, just two changes. Not only that, but these policies have been proven. Whole Foods has been doing it, and Indiana and Singapore, and it would save us $2.4 trillion per year. You say, well, why is a marketing guy talking? It's because it has to do with marketing. Karl Marx knew that something like 30% of the price you pay for an item is devoted to marketing and advertising. And he thought that was a total waste of money. And communist countries are absolutely against advertising and marketing. And so if you're leaning toward socialism and you work in marketing, you might want to reconsider. Because advertising and marketing are one of the factors that companies have to compete in. Another factor is price. So the first policy is price, but you also have to be able to tell people about it. Right now, there's no way to comparison shop. My wife went in, some kind of a thing happened with her finger, and they treated it at the urgent care. Not so. A doctor put a splint on it and said, there's not much you can do, but you might want to see a specialist. So then a couple of weeks later, she went to the specialist. The specialist unwrapped her finger, wrapped it back up, and we got a bill for $2,000. Took him about 10 minutes. Talked to her a bit, said, there's not much we can do, but they x-rayed it. $2,000. We complained. They said, well, that's the price when you see the specialist. But there's nothing they can do. Right. Well, we don't care about that. What we care about is that they might have to do surgery. And so we bill everything in case you have to do surgery. Okay, that's the kind of baloney that's happening in our healthcare system, right? I paid, at a price per hour, I paid $12,000 an hour with no surgery involved. Now, if you want proof, LASIK eye surgery, I remember it costing about $5,000 an eye when it started. Now you can get it for $500 an eye. My wife went for a little minor eye surgery, and they said it was $2,000, I think, or maybe $1,000. And then she said, well, I don't have insurance for eye surgery. How much is it? They said $200 in cash right now. Amazing. You know, say, I'm not paying with insurance. Oh, okay, we'll give you the real person price. Unbelievable. Countries without insurance have their healthcare is a tiny fraction because there's layer upon layer upon layer of bureaucracy in our system. Okay? The other thing is price tags ensure that everybody pays the same amount, unlike the story I just told you. What's the second policy? The second policy is you pair an insurance policy, a deductible, with a deductible, and a health savings account. Now, what does that do? Well, first of all, it means that your deductible is covered, right, automatically. But the most, and employers like Whole Foods has been doing this since 2002, the state of Indiana, the country of Singapore since 2007. And what happens is, so in Indiana, most of the people opt for this kind of coverage. So you get the coverage, you get the health insurance, what's covered is regulated, and then they also put in this $2,800 to cover the deductible. The great part is if you don't use it all up, you get the money. Guess what? It makes people part of the process. They say, oh, I'm not going to pay $2,000 for a 10-minute visit when they can't do anything anyway, right? Maybe you do a little research. Maybe you say, hey, I don't really know if I need that. The result is massively lower healthcare spending without any decrement. 67% are less likely to go to high-cost emergency rooms rather than the low-cost urgent care. You probably get quicker service at the urgent care. They also spent $18 less per prescription because they were more inclined to take the generic equivalents. We know that it can save 75% of what we're paying now. Right now. Only one country's had the good sense to have it rolled out nationwide, even though this idea came from the United States. Singapore is able to deliver universal coverage and the best health outcomes in the world while spending 77% less per capita than the United States and about 60% less than the United Kingdom, Canada, Japan, and other advanced industrial economies. You know that the Canadian healthcare system isn't the answer. This is the answer. This is the answer right here. We're spending 8% of GDP. Singapore spends 2.4% of GDP. You got to have people involved in the process. The waiter comes around, buffet breakfast. Would you like some orange juice? No. Well, it's free. It comes with breakfast. Oh, okay. And what do you see after breakfast? Lots of half-drunk glasses of orange juice. I had a friend who had a free Coke machine, and he was always finding half-drunk cans of Coke. Finally, he charged a nickel. This was back in probably the 70s, but let's say you charge a quarter. You charge a quarter of what it's going to cost for a Coke today. And people would finish it. They didn't finish it because, well, it's a little warm. I'll go get a new one. It just shows you. People are smart. People modify behavior. Let's get this good sense to get marketing involved in the healthcare system. Get marketing involved in the healthcare system. That's the answer. Like and share. Your friends will think you're smart. Have a great day. Bye-bye.